I believe our program is special and unique because we have a smaller program. We have 3 residents per year, and we have a high volume of bread and butter surgery, but we also have a pretty high volume of more interesting, complex surgery. And I think it's hard to find a program that has a small hospital feel, but while at the same time having a deep exposure to more complex experiences throughout training.
You know, myself, Dr. Swan, Dr. Niskorsky, the other faculty, part of the Department of Surgery, we're the ones that are going to be there when you need help, whether it's in the office, in the hospital, or in the operating room.
In perhaps the old days, you would be assigned one person to be your mentor for everything. Now we do that, we have assigned mentors, but the reality is that most people, myself included, have a mentor for clinical work, a mentor for wellness, a mentor for perhaps the more business side of medicine, and different mentors for different aspects of your career, not just clinical, but as a whole. So I think that being flexible enough to know who to go to and who to talk to and when is important. So that's what we have. Our smaller program allows us to get to know our residents really well, and our residents get to know us really well, and that's another part of our program that's special. Starting at day 1 as an intern, you'll be on the floor and in the operating room. We have early and robust exposure to operative procedures and floor management, but our residents are performing high volumes of operations really starting at day 1. So our intern year is not like many where you sort of have to wait in line to get into the operating room. We really do have early operative exposure here.
We have all of the advanced tools, instruments. For instance, the Da Vinci, we have multiple XI systems within our hospital system. We have we have 3 here at Vassar, one with a dual console. So that's our main teaching console for residents. And so, we get plenty of experience doing these cases with trained faculty.
It's a good place to live, especially if you like the outdoors, if you like to be outside, hiking, things on the river. It is a nice place to spend 5 years. And it's not too far away from New York, so a weekend getaway is definitely possible and kind of fun.
Every resident that comes to this program is as prepared as they can be for their board exams, both the written and the oral. We spend, at least a half a day every week doing didactics, lectures, resident prepared topics, and when it comes close to ABSITE time, we spend a lot of time reviewing ABSITE questions, going over topics, scenarios, so that our residents are as prepared as they can be for the in-training exam.
Now to be in this institution and work with my colleagues to train residents, it's just a wonderful job to have. I couldn't dream of wanting to go anywhere else. So my goal is to make sure that our residents get better trained than I did.
I think at the end of 5 years, we would expect you, number 1, to be a good surgeon, to also be a good listener, a good practitioner, but our main goal is really to make you a good person.